Hi, my name is Morgan Scott. I'm a psychiatric mental health nurse practitioner student at Old Dominion University. I wanted to take a moment to talk to you about the new medication you will be starting, memantine, also known as Namenda. This medication works by decreasing abnormal activity in the brain while also improving your ability to think and remember, and it can also slow the loss of those abilities. This medication is taken by mouth with a glass of water, with or without food, at regular intervals throughout the day. This medication begins working within 3 to 7 hours, but you may not feel its full effects for up to 3 months when first starting. This medication is dosed on a weekly basis for the first month. So week 1, you will take 5 milligrams once a day. Week 2, you will take 5 milligrams twice a day. Week 3, 5 milligrams in the morning and 10 milligrams in the evening. And week 4 will be your maintenance dose, which will be 10 milligrams twice a day. I will be prescribing you 5 milligram tablets in the beginning, and then we can do 10 milligram tablets after that. This medication is for long-term treatment, and it's not a controlled substance, so there's no restrictions on prescribing it. For the first month, I will give you enough tablets to get through to the therapeutic dose, and then after that, we will do 10 milligram tablets. I will give you enough for a 30-day supply with probably 6 refills at a time, but I'd like to meet with you in between to make sure that you're doing okay and you're not having any major side effects and that it's working the way it should. This medication is fairly affordable. It ranges from $10 to $100, but there are good RX coupons that put it at around $18 to $25, and we have extra resources if you need some help with that. I want you to watch out for dizziness, confusion, headache, constipation, Stevens-Johnson syndrome, renal or liver failure, blood clots in your lower legs, NMS, or seizures. And I will also be monitoring you for these side effects and the effectiveness of the medication. I'm also going to be looking for a rash, yellowing of the skin, severe nausea or abdominal pain, hallucination, suicidal ideation, signs of congestive heart failure, shortness of breath, or dependent edema. These things are rare, but they can happen, so we just like to keep an eye out. If you have any signs of an allergic reaction like rash, itching, swelling, severe dizziness, or trouble breathing, please reach out to me right away. When stopping this medication, I'd like for us to do it together. If you stop abruptly, it can cause discontinuation syndrome, so we'll need to taper and decrease slowly at about half a dose every 4 weeks until we're at the lowest dose. If you use alcohol or cannabis, please take caution. It can increase your risk of dizziness, which can then increase your risk of falls, so just limit your intake and be cautious when using those substances. This medication is not intended for pediatrics, pregnancy, or breastfeeding. It has not been tested, so for safety reasons, we avoid it unless absolutely necessary. For adults and geriatrics, the dose is usually around 5 to 10 milligrams a day. We've already done some liver and kidney function tests on you, and everything looks great. If anything were to change with that, there would be no adjustment needed if it was just mild to moderate, but if your kidneys have severely declined, we would not exceed 5 milligrams twice a day, and we would use caution with your liver. I also want you to take caution if you are using any other medications such as dextromethorphan, ketamine, acetazolamide, methazolamide, sodium bicarbonate, or amantadine. This drug can have interactions with those ones. And this medication is safe for you to take, and you can take it out in public with you to school or work, but it's only needed for the morning and the night, so try to avoid it. You don't want anybody else getting your medication, and just remember to always take your medication as prescribed. And if you have any questions at all, please do not hesitate to reach out. I will be here to answer any of your questions. Thank you.